many of you are the youngest child? I sympathize with you. I am the youngest of 4 children. My big brother Samer is the oldest. When I was little, he told me that when I grow up, I would be a princess, and I believed him. I used to select dresses that made me look like a princess. I used to act like a princess and even try to walk like a princess. I fully believed him until I was 7 years old and realized that my father, while a wonderful man, is in fact not a king. Where I work in Palestine, women who have babies at a young age are told by their mothers and mothers-in-law that their breast milk is not enough. They are told it will not help their babies to grow properly, and instead, the baby should have formula. They are also told many other things, such as to put salt on the umbilical cord. It will help them to heal faster, and to add salt on the baby's skin to help the babies fight infection. They believe that adding kuhl to the eyes of the babies will make their eyes beautiful and will improve their eyesight. And some babies are even fed food from family meals at the age of 40 days because it's a treat for them. That's what they believed. Every year, more than 6.5 million children die before they reach their 5th birthday. Around half of these deaths happen in the first 28 days of baby's life. Of course, the worst affected people live in the poorest area. And I know because I have seen this in my work. I'm a technical lead for health and nutrition in World Vision's office in Jerusalem, West Bank, and Gaza. Every day, I work with our programming in Palestine, and I see the impact of the contest on the health of women and children. The health system is very fragmented. Restrictions on free movement of people as a result of the occupation have seriously impacted the provision of efficient and effective healthcare in the West Bank. So much so, the World Health Organization estimated in 2012 that access to essential health services is impeded for nearly 1 million people in the West Bank and around 1.4 million people in Gaza. Yet roughly 40% of the population is either women of reproductive age or children under 5. Children die at the rate of 20 per 1,000 live births in the West Bank and 25 per 1,000 in Gaza. The anemia prevalence rate is double that of Europe, and exclusive breastfeeding is estimated at only 26.5%. A study in the Bethlehem district found that many of the reasons for this low rate were social and linked to family pressure and perceptions of poor quality of breast milk, like the story I shared with you. Yet breastfeeding is incredibly important. A study published in the medical journal, The Lancet, shows that exclusive breastfeeding for the first 6 months of child life reduces under 5 deaths by 13%. And complementary feeding and continued breastfeeding past 6 months reduces under 5 child mortality by 6%. There are many other gaps. Parents are subjecting their infants to harmful practices, believing that those practices are good for them. We decided that we needed to do something about this profoundly depressing facts. So we piloted a health approach called Timed and Targeted Counseling, or TTC. TTC is an innovative and adaptive practice that is effective at improving maternal, newborn, and child health and nutrition outcomes, exactly the need we were facing in Bethlehem. The practice specifically builds the capacities of families, communities, and governments to make the necessary health interventions to reduce the morbidity and mortality rates of newborns and mothers. TTC is delivered at the household level by a trained group of community health workers. Usually, they are volunteers. The model provides advice for the crucial early days of child's life from the 3rd trimester of pregnancy through its 1st birthday of baby's age. Through the model, community health workers become regular visitors to the homes where a mother is expecting or caring for a young child. These workers give accurate, preventive, care-seeking advice to the primary caregivers as well to other members of the household. These are people who make decisions or giving advice on raising the child, such as mothers-in-law and grandmothers. With each visit, the volunteer monitors the outcomes of the previous counseling while providing new advice appropriate to the child's development stage. This work is also supported on community and national levels. At the community level, the capacity of community groups is built to address and monitor local cases of illness, death, and malnutrition. They work for quality health service delivery, monitor home-based care services, and help to build a good environment for positive health outcomes. On the national level, partnerships are formed with national government and other key stakeholders to ensure community-level quality of health and nutrition services. All these efforts are focused towards strengthening existing community-level structures to improve child well-being in sustainable ways. The original pilot of TTC aimed to reach 330 households in 11 communities in Bethlehem, and through the work, we quickly saw that TTC is a highly effective and efficient model, very relevant to the context and the needs of the target population in Bethlehem. It also showed a high return on investment and with potential for sustainability. How do we know it's highly effective and efficient? We tested it, comparing the results in Bethlehem communities, where World Vision used TTC with communities where we did not. Remember the Lancet study that shows exclusive breastfeeding for the first 6 months of child's life reduces under 5 deaths by 13%. Because of TTC, 42% more mothers in Bethlehem are exclusively breastfeeding than in the non-TTC group where World Vision did not have any interventions. 27% more are breastfeeding above 1 year, and 33.2% more mothers are able to recognize danger signs in their baby's health. 28.8% more mothers are managing diarrhea appropriately. We also saw increases in the TTC households of pregnant women taking iron and folic acid, in mothers knowing the danger signs of pregnancy and postpartum danger signs. Nutrition improved. There was a 50.4% increase in children with minimum dietary diversity and 71.7% increase in minimum meal frequency. These are all interventions that reduce under 5 mortality. The secret to the model is that it delivers the right information at the right time to mothers and caregivers. Information that is timed and targeted. It delivers advice to mothers for their exact stage of pregnancy or the life of their child. In the intimacy of the home, the community health workers are able to influence behavioral change, enabling the mothers to make good and right choices. Mothers become more confident. They have a source of information that they can rely on. The TTC model is also highly cost-effective with minimal setup and infrastructure cost to consider. It draws on existing structures and early partner and government involvement. It focuses on social and family connections that increase the efficiency of knowledge sharing across a community. In Bethlehem, the model cost around $120 per household. The evaluation in Bethlehem undertook a cost-effectiveness analysis and found that in this context, TTC came in 7 times under the World Health Organization benchmark for cost effectiveness. I'm here today to share with you the success that I saw this model have. It works as intended to empower women and caregivers to make positive health decisions for themselves and their infants, alongside greater support from husbands and family members. And it's not just me who believes this. The majority of community health workers interviewed in Bethlehem TTC evaluation mentioned that a woman in targeted households have started to discuss childcare issues with their husbands, while the caregivers interviewed believed that there was now more cooperation between men and women in raising their children. The evaluation also found that all the right elements are in place in Bethlehem for continuation of TTC and its sustainability. This includes local ownership, community-based capacities, and strengthening partnership between communities and key governmental stakeholders. The model has established collaborative networks between organizations, community health workers, community health groups, primary healthcare staff, and the Ministry of Health, all of whom are now willing to support and invest in the resources required for the model to function. The evaluation also showed the importance of close collaboration and coordination efforts with the Ministry of Health while planning and implementing the TTC model, including direct involvement in training and supervision of the community health workers. Based on the evidence of contribution to change collected in this context and the commonalities of the situation in Bethlehem with many others in the world, TTC is recommended as a model for achieving sustained health and nutritional improvements for the well-being of mother and children across many other contexts. With World Vision, the TTC evidence-based practice is already being scaled with confidence from the area program in Bethlehem to all 14 World Vision local program areas as a core technical approach for improved maternal, newborn, and child health and nutrition across West Banks. Results from these projects also show comparable and significant improvements in health and nutrition practices at household levels. We believe that if TTC were to be more widely adopted in those areas where we continue to see horribly high levels of maternal mortality and infant death, we could start to see a shift to a world where whatever your level of income, pregnancy could be seen as a happy and healthy time, and infancy would just be about the joy of having a new soul growing in the world. There was no lasting damage for me believing that someday I would be a princess. After all, in the eyes of my father, I am a princess, but other cultural beliefs can be really dangerous. Let's get the right counseling at the right time, in the hands of those that need it most. There is no greater happiness than saving the lives of people in need and supporting them to be healthy, regardless of all the challenges. After all, aren't all babies prince and princess? If you want to know more about timed and targeted counseling or any of the evidence for change work that World Vision is doing, there is a website, wvevidenceforchange.org. Thank you.